At hundreds of millions of dollars, it said the Bahamas has the highest healthcare costs in the Caribbean, but an underfunded healthcare system. This then begs a series of questions, like are Bahamians getting value for their money, and how can healthcare be funded moving forward? Those questions the focus of a health forum hosted by Jones Communication Network on Tuesday evening with panelist Health Minister Dr. Dwayne Sands, who stressed that Bahamians like to eat, don't care about exercise, don't have the most responsible sexual habits, and a tremendous proclivity to violence. Put that together, there's tremendous mismatch, he said, between demand and the ability of the public purse to supply healthcare services.
The demand is insatiable. What we need to do, having recognized that problem, is figure out how do we improve healthcare services, but perhaps look at opportunities to grow the economy of the Bahamas through healthcare, which is internationally the single most rapidly growing industry in the world.
The government has long been working on making healthcare appropriate and affordable, and that's where national health insurance comes in. NHI Chairman Dr. Robin Roberts, who admits that's a very tall order.
When you look at it, the first thing that you have to appreciate is that it means that's cost. Healthcare, whether with regards to a national health insurance, is about funding the cost of healthcare.
President and Chief Medical Officer at Doctors Hospital, Dr. Charles Digby, says over the years the private hospital has evolved beyond being simply an institution that patients can afford.
So Doctors Hospital has evolved to become an institution that responds, albeit to a private sector patient, a patient with the ability to afford. But Doctors Hospital has evolved and developed itself to be able to at least step up to the expectations of patients, expectations on quality, expectations on safety, and a realization that those expectations would have an attendant cost. And we carry a theme of high touch, high tech, quality, and a valued healthcare experience. Though we are not the predominant sector, we appreciate that. The public sector perhaps multiplies us by 10 or 15. We are a significant sector, and no doubt most of the innovations that have occurred in healthcare in the country would have involved Doctors Hospital.
And a quick check on sports and weather when we return.